Good morning. I'm so glad to see all of you this morning, and I want to thank you for dedicating your time for us to come together to discuss our organization as a whole and walk through our restructured business plan. For any of you who I have not had the chance to meet yet, my name is Melissa Mansfield, and I have recently been hired as the new mental health administrator for the Journey of Hope Clinic, and I am so excited about taking on this new role. When I was hired for this position, I committed to getting to know the intricacies of the organization. And what I noticed was that there were already some really good things in place here. However, there were additional areas that needed some development. And I would like to thank those of you who joined me for the initial planning meeting that I invited the staff to, which I did because I truly want you to feel like the success of our organization is a team effort. And I also want you to know I value your opinions because at the end of the day, you have been here in the trenches before I came along, and I want to acknowledge that. I also want you to know that as a leader, I believe in teamwork and collaboration to ensure that we provide quality mental health care to those in our community. And so now we're going to go over our vision and mission statement, as well as look at our goals, which are quite comprehensive. So I hope you don't mind if I do have to refer to my notes every once in a while in order to make sure that I adequately cover all of the information that I would like to go over with you today. And so the vision and mission statement were great, and they have remained mainly the same. But in reviewing it, we just felt like we needed to add some additional components to them that clearly defined who we are as an organization and what we are striving to achieve moving forward. And so the vision statement is at the Journey of Hope Clinic. Our vision is to be a pillar of excellence in developing and delivering quality mental health care services within the community to promote prevention, intervention, and recovery for individuals living with mental illness and improve the lives of individuals and families on their journey to emotional wellness. The mission statement for our clinic is the mission of Journey of Hope Clinic is to educate the community on mental health awareness, increase access to mental health treatment through the removal of barriers and stigma, and provide high quality care for individuals and families that is evidence-based, compassionate, and culturally competent. And I think these are well-rounded statements that are achievable through the organizational goals that we are going to review today. So our first goal is to increase patient access to mental health services. And this goal is extremely important because accessibility is a major issue in mental health care in the community right now. And as you know, there are so many barriers that prevent individuals from being able to access mental health care, whether those are financial reasons or stigma, lack of knowledge of where to access services, or the inability to physically make it to the facility to receive services. Those are just a few of those barriers, and there are others as well. So we want to expand accessibility to mental health care, and that's going to include things like virtual therapy, which became very popular after the COVID-19 pandemic, partnering with transportation companies in order to contract transportation services through companies or social services, as well as communicating with Medicaid and Medicare to ensure that they are providing covered transportation services as well. It also includes working with primary caregivers to integrate mental health care into general health care, because by partnering together with primary care physicians, we can increase accessibility for patients since they are already existing patients and do not have to get on a wait list for mental health care. We are also going to be partnering with LaPorte ISD, and I am super excited about this. We're going to partner with them to provide care for individuals such as our students and even family services through a grant program that they received from the state. And so we actually have signed an MOU with the district, which is a memorandum of understanding if you're not familiar with that term. And basically that just kind of outlines the terms of our partnership and our contract with them for the services that we plan on providing. We will be funded through that grant to provide mental health care through referrals by school staff, which will primarily be through the school counselors, to provide services either at our Pasadena facility or even to come on campus to deliver therapy services, which will primarily be for the student, but can also include parents as a part of the session. If there's private insurance or Medicaid, sessions will be billed to reimburse us, and the copayment will be paid through the grant. If there is not insurance, then the grant will pay fully for those sessions. And I think this is going to be extremely effective in increasing accessibility to mental health care for students and families that live within the LaPorte School District area. The second goal is maintaining a highly qualified staff through training and professional development. And so this goal is crucial in order to stay up to date on new strategies in mental health care and effective practices, as well as ensure that our staff is knowledgeable in culturally competent care, and to ensure that we are providing best practices by utilizing evidence-based practices. Regardless of our ability, refreshers are always needed. And, no matter how long you've been doing this, we can always learn. And I'm a firm believer of the saying that when we know better, we do better. And so as these external factors in our community change, then the type of services that we deliver within the community also have to change. And so we have to stay abreast of new innovative strategies, such as virtual or telehealth care, that are effective in mitigating mental health symptoms. Training also includes areas such as making sure that we are keeping adequate documentation of sessions, reminders on ethical guidelines and professional boundaries, and updates on legislation that may affect funding or mental health services, as well as billing practices, which we're going to talk about shortly. Our third goal is enhancing quality of care to improve patient outcomes. And this goal really is an intersection of the goals that include training and professional development, using evidence-based practices, and ensuring the delivery of culturally competent care. And evidence-based practices are the expectation because they are rooted in research and their efficacy can be proven. Also, being aware of the diversity in our community and how we can meet the needs of our clients enhances the delivery of culturally competent care, which is important. And although those areas are important, enhancing quality care encompasses so much more than that. It starts from the moment our clients walk in the door at Journey of Hope. And it's rooted in how we treat them, how we interact with our clients, how we provide empathy and understanding when they are going through a difficult time, and how we can be a safe space for them. It also includes sensitivity when approaching tough conversations, such as maybe the inability to pay for services or having a bill that's past due. And so all of these are important because quality care is multifaceted. Our fourth goal is expanding community outreach. And this is something we will continue to work on, but we're going to work on achieving this primarily through providing mental health awareness to the community through partnerships with the school district, as we discussed before, and also partnering with local businesses to speak to employees and supervisors about mental wellness and navigating stress in the work environment, which is super important. One upcoming event I'm very excited about is an event that we will be co-hosting with the school district and the city of LaPorte to bring mental health awareness to all of the community. I have actually been invited to be the guest speaker, and I'm very honored to do that. And then there will be breakout sessions on a variety of mental health topics and resources that parents and individuals in the community will be able to attend based on their interest or preference. The district school counselors have been asked to facilitate breakout sessions, and I am hoping that some of you will sign up to present as well, which I know we haven't talked about yet, but we will discuss at a later date when I have more details. We will also partner with Sarah's House, which provides a safe space for mothers and children who have experienced domestic violence and working on providing services for them. Community outreach is going to allow us to not only partner with the community to provide services, but also partner with the community to open the doors for increased funding for our organization through private donations or community funding sources and increase our cash flow, which is important. And that brings us to our last goal, which is achieving financial sustainability. And so financial sustainability is not just a goal. It is a vital component in mental health systems because without funding, our organization cannot continue to exist. So when discussing financial considerations, we have to examine accounts receivables, collections, and our cash flow balances. And for accounts receivable purposes, we want to make sure that we are sending in invoices promptly to expedite payment, that we automate invoices to send that will automatically produce follow-up for collection activities or collection invoices if needed. We can also offer automatic payments where we obtain permission to charge a client's credit card based on a repayment plan that we have made with them. And then we also want to make sure that we maintain accurate records of insurance and payments. One very important facet of the financial aspect of the organization is accurately coding and billing for services in order to avoid a delay in payments or insurance approval and reimbursement. And so that actually brings me to an issue that I wanted to discuss with you that caught my eye when I was reviewing billing records. As I told you, when I was hired on, I really took some time to delve into all of the areas of the organization, and billing and finances would obviously be one of those. And so in reviewing the records, there were some fees or charges that were not quite clear to me. And, I am definitely not saying that anything was intentional or trying to be snuck in there. I'm not saying anything like that. But I do want to just mention that these mistakes could result in denial of coverage from insurance companies, which affects our cash flow. And in order to make sure we are operating from a positive ethical standpoint, we want to make sure that all of our billing is transparent and that there are no hidden fees that may show up and surprise our clients or cause insurance to deny a claim, which then puts the responsibility on the client themselves. Not only could it damage the trust between the patient and us, but it could also cause us to be flagged as out of compliance if we were audited. And that is something that I never want to happen, especially in my first year as the mental health administrator. So we are definitely going to follow up with some additional training just to ensure that we all understand those diagnostic billing codes and the process for billing. We want to make sure that what is being coded and billed to the insurance companies is reimbursable without question. And then as far as additional considerations for financial sustainability, we are also going to be using a financial accounting software that will manage cash flow, track expenses, generate reports, and also just help us improve our overall accuracy and accountability for records and auditing purposes. Our office staff is going to be trained in using the software, so they are going to be the experts on that. We want to also make sure our billing systems are efficient in order to ensure timely payments from insurance companies and patients. And then finally, I will be putting a team together to explore federal funding and grants that we could apply for through federal and state government legislation and programs that will generate additional cash flow and revenue so that we have an accurate picture of the money that's coming in, and we can use that to develop a budget that is going to adequately cover the operational cost of the organization. And so I know that was a lot to take in, but in order to respect your time, I think we have covered enough for the day. I would like to ask you to please be on the lookout for a follow-up email that is going to provide a date for follow-up discussions to evaluate our goals that we have set and make some changes if necessary. I welcome your feedback at any time, and I look forward to progressing with you and ensuring the success of our organization. So thank you so much, guys, and enjoy the rest of your day.